all are waiting for nursing exams, you all are waiting for to become a government nurse. And this series, we are today from today we are starting MCQ discussion based on the previous exam. It will be very helpful for your Norcet exam. Okay. As you all know, they're planning exam on actually they're conducting exam in two stages. That is one prelims and mains. The for prelims exam you have only 41 days from today, and it's very critical time. And it is not. If I'm telling truly, it's not enough to study our whole syllabus. The only thing we can do, we can practice the previous questions. If you are studied theory, everything you know means you can study MCQ questions. That means you can practice previous questions. If you come through the previous questions, you will get an idea how to write, what are the important topics you may get in the exam. Okay, in this video, in our channel also, we are starting on series of question discussion. Today is the day one. You can follow and subscribe our channel. If you like the video, please like it. And if you have any comments or suggestions, you please write it in the message boxes, and I will make the corrections based on that. Okay, from today, actually, we are not getting enough time, and unexpectedly, the notification came, and we are not getting enough time to prepare the slide presentation and all. So I'm going to rank file. That means previous questions, and I will teach from there. I will read continuously. I'm not going to give more discussion. I'll read the question, I'll read the option, I'll read the correct answer, and give explanation also. That's all. Okay. Everybody, don't waste your time. Only 41 days. You can make it round figure, that is 40 days, and practice per day 250 questions. It is more than enough. Okay. Thank you for watching my videos. Okay. Don't skip the video. Let's start. Here you can see today I'm starting the basic topic. First we should have an idea about the basic topics. It is first chapter is related to cell and tissues. Even though it is a basic topics, nowadays the exams in the exams we are getting so many questions from this basic topics also, because always we have this tendency to, those who are studying for exam have the tendency to focus on the complex topics only. But maybe because of that they're asking simple questions also, but we will miss that questions. Okay. To avoid that, we will start from basic topics. Actually it's all questions from the PR Yadav textbook only. It's very good textbook, and most of the previous questions are there added in this edition. Okay, we'll start. First question: the basic unit of life. As you all know, basic unit of life is cell, but some people have confusion like whether it is atom or like that. Okay, here the options are: first option is atom, second option is water, third option is cell, and fourth option is chemical level of organization. The correct option is option C, cell. As you please not this one. Structural and functional unit of life is cell, and sometimes they may called as a structural unit of body, basic unit of life, physical basis of life. Everything is same. It's everything. The answer is cell only. Atom is, what is meant by atom? Atom is the smallest part of an element. Okay, in an element, atom is the smallest part. But when we are asking about basic unit of life, physical basis of life, we should answer. We should know that is cell. Okay. Second question: these are the basic units or building blocks of living organism. These are the basic units or building blocks of living organism. What is the same thing? Basic units or building blocks of living organism means that is cell. Here options: enzyme, proton, cells, neutron. Correct option, option C, cells. Okay. Next question: physical basis of life. In the first question itself, I told you physical basis of life is cell. Here options: nucleus, protoplasm, DNA, but the physical basis of life means cell. Next question: main difference between a prokaryote cell and eukaryote cell is the absence of. There are two types of cell, that is prokaryote and eukaryote. In the prokaryote, What is the difference between, you should know the difference between prokaryote and eukaryote. Here you see what is absent in the prokaryote. Okay, prokaryote, what is absent? We should know that. What is absent? Plasma membrane absent, mitochondria absent, true nucleus absent, flagella absent. Correct option is option C. True nucleus. True nucleus is absent in prokaryote cell. Please note it down. Prokaryote cells lack membrane bound cell organelles and nuclear membrane around chromosome. As you all know, eukaryote cell, that is our cell, animal cell, eukaryote cell have defined nucleus, exact nucleus. We have nucleus having nuclear membrane, double layer nuclear membrane, nuclear pore, nucleolus, nucleoplasm, everything is there. That if everything is there, then we can tell us it's a true nucleus. And if it is no nuclear membrane, then we should tell like say false nucleus or true nucleus absent. In that which type of cell we can see there is no nuclear membrane, that is prokaryote cell. In the prokaryote cell there is no exact nuclear membrane, but in eukaryote cell you can see exact true nucleus with the nuclear membrane. All the part of nucleus is present in eukaryotic cell. Okay, next question. Which of the following is not assimilated by eukaryote? Assimilated means absorbed and digested. Absorbed and digested. This used. Okay, absorbed and digested by eukaryote cell. Here options are lactate, sulfate, nitrogen, glucose. But eukaryotic cell will not assimilate, will not absorb and use nitrogen. That is the correct option. Option C, or nitrogen will not be assimilated by eukaryote cell. Okay. Next question, it's very important, very simple, but repeatedly asked question. Which organelle called powerhouse of the cell? Powerhouse of the cell means which organelle is producing energy? Nucleus, Golgi bodies, mitochondria, ribosome. Which organelle is producing power? The energy, that is mitochondria. Mitochondria is known as powerhouse of the cell. Here you can see so many exams. Till now, so many exams they are asking questions from this topic, that is powerhouse of the cell. Which is the powerhouse of cell? That is mitochondria. Here you can see mitochondria or mitochondrion is a cell organelle of rod or oval shape. That what is the shape of mitochondria? It will be like this, rod shape or oval shape, and they contain enzymes for aerobic stages of cell respiration. That means our glucose metabolism, everything, cell respirations is aerobic stages of cell respiration occurring where? In the mitochondria, and it is a site of ATP synthesis. That means adenosine triphosphate, that is our energy currency. It is known as energy currency. ATP, adenosine triphosphate, is known as energy currency. It is synthesized in the mitochondria and the site for oxidative metabolism. Because of that, because of the production of ATP, mitochondria is known as powerhouse of cell. Okay, next question. Which cellular component is responsible for oxidative metabolism? Already I told in the previous question itself, I told you oxidative metabolism occur in mitochondria. Okay, mitochondria, it occur in mitochondria. Correct option, option A. Next, same question. Aerobic respiration is performed by who? It's mitochondria. Already you can see what is made by powerhouse of cell, which is known as powerhouse of the cell, and which is producing ATP, which is the site for aerobic respiration, which is a site for oxidative metabolism, everything, that is a mitochondria. Okay, next question. Dash is a protein involved in forming the cytoskeleton. Cytoskeleton means in our body we have bonds, is it? So many bonds we have. Because of bond and the correct position of bond only, we have a particular shape and we have a stability. It gives support. Same like that, say inside the cell also, cell should maintain the correct shape, is it? For that there is cytoskeleton, cell skeleton, that is cytoskeleton. And which protein, what's the question? Which protein involved in the formation of cytoskeleton? The correct options are fibronectin, actin, fibrin, albumin. But in this correct option is option B, actin. Actin is the protein involved in the cytoskeleton formation. Here is the explanation. Cytoskeleton is the internal structural framework of cell consisting of three types of filament. There is three types of filaments. What are they? This also you can note it now. What are the filaments in the cytoskeleton? Microfilaments, microtubules, and intermediate filaments. Microfilaments and intermediate filaments, as well as microtubules. These microfilaments are made up of fibrils of protein actin. That's why the correct answer is actin. It's produced by fibrils of protein actin. Actin is a protein. Fibrils of this protein actin only produce, it's helping formation of microfilaments. Okay, it maintains, because of this cytoskeleton only, it maintains the shape and allowing three-dimensional structure of the cell. Okay, correct. Next question. Steroid synthesis occur within which of the following structures? Steroid synthesis occur within which organelle? Peroxisome, mitochondrion, Golgi apparatus, and none of this. Correct option is option B, mitochondria. Steroid synthesis occurs in the cytoplasm and mitochondria. It's noted down. Steroid synthesis occur in cytoplasm and mitochondria. And next question, the aqueous component of the cell. Aqueous means water. Water component of the cell within which various organelles and particles are suspended. That means the jelly. Inside the plasma membrane, there is a water part. And in this only, the cell organelles are suspended. Then what that water part is called as what? Cytosol, nucleus, cytoplasm. In this, you may confuse with the A and B. Some people will write cytoplasm, but you should know that water part is known as cytosol. Once this organelle suspend in this, okay, this water part including organelles called as cytoplasm. That water part is our aqueous part is known as cytosol. Here, this is the cell. In this is water or jelly like a substance. This water part is known as cytosol. In this, all these organelles and all suspended, including this water and these organelles called as cytoplasm. Okay, understood? Okay, next question. Cytoplasm means all components between nucleus and cell membrane, including all component that is cytoplasm. Only the water components means cytosol. Okay, cytoplasm includes cytosol and organelles, cells, internal substructure. Example, mitochondria. Cytosol is the only fluid of cytoplasm and aqueous solution of iron and nutrients. Okay, next question. 12th question. The organelles concerned with the metabolic process are present inside. The organelles concerned with the metabolic process are present inside which part? Ribosome, mitochondria, cytoplasm, endoplasmic reticulum. Correct option, the organelles involved or concerned with the metabolic process present in cytoplasm. Inside the cytosol, there is an organelle. Total it together called cytoplasm. All organelles involved in the metabolic process present in cytoplasm. Next question. Proteins that are to be used outside the cell are synthesized. Proteins that are to be used outside the cell are synthesized. So we need in our body for many reaction, many chemical reaction, many process, growth and development to maintain viscosity, everything we need different types of protein. Even the protein used outside of the cell, it is produced in an organelle present inside the cell only. What is the organelle? When we said already, I took class detailed explanation about cell in English and Malayalam. Both classes are available in our YouTube channel. You can watch and study from these questions. Everything theory part I explain in that video. If you want to go through that, you can go and study that one also. Okay, but this is enough for your Aiims exam. These questions itself is more than enough. Okay, proteins that are produced from the rough endoplasmic reticulum in the cell. Different organelles are there. Endoplasmic reticulum itself, there is two types. That is rough endoplasmic reticulum and smooth endoplasmic reticulum. Why it is known as rough endoplasmic reticulum? Because of the rough surface. Why it is rough surface? because of the presence or attachment of ribosomes. Because of the ribosomes, presence of ribosomes only, some endoplasmic reticulum known as rough endoplasmic reticulum. This rough endoplasmic reticulum only producing or synthesizing proteins. Okay. Here you can see the explanation. Ribosomes attached to outer surface of endoplasmic reticulum synthesize protein for use of outside the cell. The free ribosome synthesis proteins used in the cytosol, and ribosome inside the mitochondria synthesis proteins only into the mitochondria. Okay, just to understand, our endoplasmic reticulum, rough endoplasmic reticulum is contained in the surface of endoplasmic reticulum. There is a bead-like structure, that is ribosome. These ribosomes only helping to produce synthesis, that protein used outside of the cell. But in other than rough endoplasmic reticulum, the mitochondria also ribosomes present. The surface of mitochondria also ribosomes present. It also produce what? Protein. It will be used inside the cell, inside the mitochondria. Smooth endoplasmic reticulum does not have the ribosome on its outer surface. That's why it is known as smooth endoplasmic reticulum. Clear? Next question. Endoplasmic reticulum is concerned with the synthesis of what? Already I told you, it's synthesizing proteins. Okay, it's synthesizing. Endoplasmic reticulum is producing protein, specifically rough endoplasmic reticulum producing proteins. Okay, protein synthesis is the function of smooth endoplasmic reticulum, rough endoplasmic reticulum, Golgi apparatus, mitochondria. Correct option, option B, rough endoplasmic reticulum. Okay, also you may be thorough with this topic, but even though you know this cell and tissues, you should, at least once you should read these questions, but then you will not forget. Revision is the better thing into study. Okay, don't study theory and go, just practice questions only. Even if you are familiar with this topic also, 100% if you know also, just do the questions and go, then it will improve, furnish your knowledge. Okay, next question. Tissue repair can take place due to the synthesis of protein which occur in the, okay, which occur in the tissue repair. For tissue repair, any wound, any cut, any damage of tissue, to repair that particular tissue, we need proteins. Is it? For that, proteins are produced in the which organ? Mitochondria, Golgi apparatus, ribosomes, endoplasmic reticulum. Here you will get confusion like what I have to write, endoplasmic reticulum or ribosomes. But here you should write ribosomes only, because in the ribosomes only protein synthesis. When we will select endoplasmic reticulum, if they particularly told rough endoplasmic reticulum, you can select that answer. And if there is any option like a ribosome, you can select that option. Because that protein synthesis occur in ribosomes present in the endoplasmic reticulum. The ribosomes only protein synthesizing. But why we are choosing rough endoplasmic reticulum as an answer? Ribosomes attached or found in outer surface of endoplasmic reticulum only. Okay, next question. Which medium is suitable for cellular activity? Acidic, neutral, basic, all of the above. Correct option is basic. Basic medium is the correct medium for cellular activity. It should not be acidic. Here you can see the explanation. The pH means number of hydrogen ion. pH of cytoplasm for normal cellular activity is 7.2. It is slightly basic. What is maybe acidic and basic? If pH is 7 or less than 7 means it is acidic. 7 means neutral, and more than 7 means it is basic. Here it is 7.2, so it is not as basic. Except lysosome. Lysosome also in an organelle inside the cell only, but in the lysosome the pH is around 5, that is less than 7, that is acidic. Okay, acidic. The neutral or even slightly acidic pH 6.95 may result in coma and death. Maintenance of pH, blood pH, cellular pH is very essential. Okay, 7 is the normal pH of what? Which part? Which part is the normal pH? 7 we can see. Blood in the testicular vein, fluid within the typical cell, blood in the renal artery and urine. Correct. This option is option B, fluid within the typical cell. Okay, inside typical cell, fluid should be normal pH is the normal pH of fluid present inside the cell is 7. Okay, how much water is there in the form of liquid in cell of our body? How much water should be there? 50 percentage. Okay, correct option is 50%. 50 percentage of water should be there in our cell. Okay, cytosol. Cytosol means in fluid present inside the cell. That's otherwise known as intracellular fluid. Fluid present inside the cell is called a cytosol, otherwise intracellular fluid. The fluid portion of cell constitute about 55% of total cell volume. What is cell volume? Total cell volume. In that 55% water totally. Cytosol consists of 90% water and 10% other various dissolved substances like glucose, amino acid, ions, and waste products. Okay, next question. Aquaporins means what? That is, aqua means water. Porine means hole or channels. The correct option, water channel. Aquaporins options, sodium channels, potassium channels, water channels, chlorine channels. Correct option, option C, water channel. That means that pore or a hole permit the exchange of water, in and out movement of water. Aquaporin is a cell membrane protein that lets water flow into and out of the cell. That's why it's known as water channel or aquaporin. Okay, next topic related to DNA and chromosome. We will read some questions here. First question is, chromosome contain. Chromosome means it's contain DNA, RNA, both or none. Correct option, chromosome contain DNA, that is our genetic material. Chromosomes in nucleus of eukaryotic cells are linear long strand of DNA, deoxynucleic acid, deoxyribonucleic acid, and then some associated proteins that carries genetic information from one generation to another. DNA and some other proteins that carries genetic information. It carries genetic information from one generation to another generation. Using both this protein and DNA together called as chromosomes. Next question, the genetic material deoxyribonucleic acid, that is DNA, deoxyribonucleic, this full form also you should study. Deoxyribonucleic acid is contained in which organelles? That is chromatin, nuclei, chromosome, nucleus. That contained in chromosome. Okay, chromosome, it contained in chromosomes or nucleus. Next, which of the following is a long continuous strand of, which of the following is a long continuous strand of DNA that carries genetic information? Correct option, not ribosome, not nucleus, not mitochondria. Correct option is option C, chromosome. Next question, the number of chromosomes in normal human cell. Number of chromosomes, that is 46 or 23 pairs. 46 chromosomes or 23 pair chromosomes. Human cell contain how many genes? Correct option, 1 lakh. Thousand options are 1,000, 10,000, 1 lakh, 10 lakh. Okay, correct option, option C, 1 lakh genes we have in our cell. Okay, initial predictions of human genes are 1 lakh. Now it is revised and estimated like 20,000 to 25,000 protein coding genes. Next one, trend. Actually, you will not get questions from this DNA and all, because we are not studying detail about genetics. So not only small portions we are studying. So you can't, you will not, there is no scope for asking questions from genetics. Okay, but anyway, we will read these questions and go. Transfer of genetic information from one generation to another is accomplished by transfer of the genetic character is accomplished by what? That is by genetic DNA. Through the transfer of DNA only we are getting our family characteristics, or our father and mother genetic characteristics will be coming to our generation. It will be transferred to next generation through the DNA only. Deoxyribonucleic acid is a complex nucleic acid of high molecular weight, consists of nucleotides. These nucleotides are arranged as two long chains like with a hydrogen bond. Okay, that also you just note it. Next, two strands of DNA are held together by which of the following? The between what type of bond we can see? Hydrogen bond. It's important. DNA, two strands of DNA are held together or attached together or fixed together by hydrogen bond. Okay. Next question, DNA double helix is maintained by hydrogen bond, covalent bond, phosphodiester bond, van der Waals forces maintained by hydrogen bond. Next question, what type of compounds purines and pyrimidines are? Purines and pyrimidines are known as heterocyclic, homocyclic, metacyclic, monocyclic. Correct option is heterocyclic. Purines and pyrimidines are heterocyclics. Purines and pyrimidines are the parent of a group of heterocyclic nitrogen compounds. Cytosine, thymine, this and all. When actually it's everything coming in the genetics only, but so no need to get confused. Just read the question and answer. That is enough. Cytosine, thiamine, and uracil are pyrimidine. Adenine, guanine are purine, that is building blocks of DNA. Cytosine, thymine, and uracil. These three are pyrimidine. Adenine, guanine are purine. Okay. Next, the base present in the DNA but absent in the RNA. Present in DNA but absent in the RNA. Okay, what is that? Thymine. Thymine is present in DNA but it's not present in RNA. Okay, thymine, a pyrimidine base present in DNA, not in RNA. Okay, uracil, a pyrimidine base present in RNA, is pairs with adenine. Okay, but uracil present in RNA, thymine is not present in RNA. Next one. Adenine in adenine in DNA structure pairs with adenine pairs with is compared or combined with what? Thymine. Adenine combined with thymine. Pyrimidine base present in DNA is thymine. Okay, pyrimidine present in DNA is thymine but not in RNA. Purine base found in RNA and DNA, both RNA and DNA contain which one? Adenine. Adenine. Okay, purine present in found in RNA and DNA, that is adenine. Next question. The process of copying the DNA sequence of a gene into messenger RNA is called. That process of copying gene into a messenger RNA, mRNA. This process is known as transcription. Okay, transcription. What is meant by transcription? The process of copying the DNA sequence of a gene into a messenger RNA. The copying DNA sequence of the gene into messenger RNA, that is known as transcription. Transcription is the first step in protein synthesis. Transcription is the first step in protein synthesis. During this step, synthesis of messenger RNA molecule occur by a complementary copy of DNA gene. This takes place in nucleus of the cell. Takes place in nucleus of cell. The mRNA then travels into ribosomes in the cytoplasm. Their ribosomes will produce or synthesize protein. Okay. Next question. Which mode of information transfer usually does not occur? DNA to DNA will occur, DNA to RNA occur, DNA to protein, all occur in working cell. Correct option is DNA to protein will not occur. DNA to DNA will occur, DNA to RNA will occur, but DNA to protein information will not occur. Okay, correct option, option C. DNA to protein formation never occur in the cell. Protein synthesis, first DNA form mRNA, then mRNA into ribosomes form protein. Okay, next, a medical disorder resulting from mutation in the DNA. Mutation means changes. Is it? Resulting from mutation in the DNA repair system. Correct option. Bloom syndrome. Bloom syndrome. What is by Bloom syndrome? It's a medical disorder resulting from mutation or means changes. Mutation in the DNA repair system. That is Bloom syndrome. Okay. Bloom syndrome or congenital telangiectatic erythema is an autosomal recessive disease caused by chromosomal abnormalities. Example, mutation in the BLM gene. Mutation occur in the DNA repair system cause present formation of Bloom's syndrome. It is characterized by facial rashes, mild immune deficiency, and dwarfism. Okay, these are the characteristics of Bloom syndrome. Human BLM cells are sensitive to DNA damaging agents such as UV rays. Okay, next we will study. Next topic is tissue. It's very, very important. So many questions they are asking from tissue. Basic topic only, but you may get questions from this topic also. Which of the following is an example of tissue? What is meant by tissue? When same type of cells, more than one cells come together or group of cells come together, then it is known as tissue. Here mainly tissues are classified into epithelial tissue, connective tissue, muscles tissue, nervous tissue. Again, connective tissue is divided into different types: loose areolar tissue, dense areolar tissue, adipose tissue, reticular tissue, cartilage, bone, fluid connective tissue like blood and lymph. Like there's so many classification is there. What with these things we study in the anatomy and physiology in the first year of nursing. Here they are asking what is an example of tissue. Brain is an organ. Liver is an organ. Stomach is an organ. Correct option, blood. Blood is a connective tissue, that is fluid connective tissue. What are the two types of fluid connective tissue? Blood and lymph. Except blood, it's a liquid connective tissue. Fluid or liquid connective tissue. All other are organs. Once group of similar cells come together, then is known as tissue. When different types of tissue come together, it forms organ. Different types of organ come together, it form organ system. Different organ system comes together, it make organs. Okay, that is the level of organism organization. Next, which of the following is not an autoimmune system? Systemic lupus erythematosus, syphilis, rheumatoid arthritis, sclerosis. In this, rheumatoid arthritis is not an autoimmune disease. A disease which is caused by autoantibodies produced either by B lymphocytes or self-reacting T lymphocyte against self-antigen or autoantigen called autoimmune disease. In our immune system, any auto antibodies produced and it is causing any disease means that is known as autoimmune disease. But in this rheumatoid arthritis is not caused by autoimmune disease. Next question. Okay, one little more. Examples for autoimmune diseases are systemic lupus erythematosus, rheumatoid autoimmune disease. Rheumatoid arthritis is not an autoimmune disease. Rheumatic fever, multiple sclerosis, glomerulonephritis, myasthenia gravis. These are multiple sclerosis, glomerulonephritis, myasthenia gravis, chronic thyroiditis, Reiter's syndrome, Graves disease. These are all autoimmune disease. Next, a patient admitted with an autoimmune disease asks the nurse what it means. The appropriate response by the nurse. Actually, one patient, I am admitted in the hospital. Somebody told like I am suffering from autoimmune disease. Then I am asking to nurse, sister, what is meant by autoimmune disease? And as a nurse, what you will give answer? Correct option, option D. Immune cells are unable to distinguish between ourself and other cells. Okay, our immune system can't identify or can't discriminate our own cell and antigen cells, outside cell, not self and self. It can't be discriminated by our immune cells. Then this problem is known as autoimmune disease. That is a correct option. Okay. Next question. Main features of systemic lupus erythematosus. What is the main feature of systemic lupus erythematosus? Red rashes over cheeks. Okay, red rashes over cheeks. Systemic lupus erythematosus is a chronic autoimmune disease of connective tissue involving multiple organ and system. And this derived from this term derived from characteristics of erythematosus, red rashes over cheeks, or butterfly rashes over the nose and cheeks. The disease is most prevalent in women and especially during childbearing age. In the pregnancy age only, it is mostly seen. Okay, the main symptom of systemic lupus erythematosus is red rashes over cheeks. Next one, systemic lupus erythematosus is a disease of what? Disease of connective tissue. It's a disease of connective tissues. Which of the following is a classic symptom of systemic erythematosus? Already I told you, superficial lesions over cheeks or red rashes over cheeks and nose. Next, what is meant by Marfan syndrome? Marfan syndrome is a disorder of connective tissue. This also you just remember, Marfan syndrome is the disorder of connective tissue. It's incurable. It's not curable. Hereditary degeneratory disorder of connective tissue, mainly like bones, muscles, and ligaments due to defect in fibrillin 1 gene, due to defect of genetic material, defect of gene. Which gene? Fibrillin 1. Fibrillin 1 gene is damaged or defect in fibrillin 1 gene. Because of that only this incurable disease, Marfan syndrome, is occurring. Okay. Next question. A structure composed of two or more tissue is termed as. Structure composed of two or more tissue means is a organ. Okay. Once same type of cells come together, it is tissue. Two or three different types of tissue come together, it's organ. Once different organs comes together, organ system. Organ systems come together, that is organism. Okay, correct option O, A, organ. A body structure made up by two or more tissues that all contribute to perform some specific functions called organ. Next question. Name of the tissue which is widely and abundantly distributed in our human body. Which connective tissue? Which tissue is most abundant in our body? That is connective tissue. It have many parts like loose connective tissue, dense connective tissue, adipose tissue, bonds, and fluid connective tissue. Major part of our body is made up of connective tissue only than other type of tissue. Okay, next question. Which of these are most abundant tissue in our body? Already I told you, correct option B, connective tissue. Which type of epithelial tissue is composed of several layers of cell? Mainly epithelial cells are divided into two types. First one is simple and stratified. Okay, simple and stratified. In the simple means cells are arranged in the single layer. Stratified means several layer. Cells are arranged in the multiple layers will be there. So stratified is known as multiple layer or several layers of cells. Epithelium with the multiple layers of cell called stratified epithelium or laminated epithelium. It's called as laminated epithelium. Next question. Which of the following statement is true? Squamous epithelia cells are cube shaped. Stratified epithelium consists of single layer. No, it is not. Stratified cuboidal epithelium has many layers of cell. Yes, stratified. This is squamous means flat shape. Flat shape of cell is squamous. Cuboidal means cube shaped. Columnar means rectangular shape. Okay, these are the three types of cells. Okay, squamous means flat shape. Cuboidal means cube shape. Columnar means rectangular shape cells. In this symbol means single layer. Stratified means several layers of cells. Okay, correct option, option C. Stratified cuboid epithelium has many layer of cell. Next topic is muscle tissue. The contractile protein in skeletal muscle. Contractile protein in skeletal muscle, troponin, titin, tropomyosin, and actin. Correct option, actin. Actin filaments. You maybe heard about this. Actin is the contractile protein found in muscle. Contractile proteins in skeletal muscles are actin. Now you note this, actin and myosin. Okay, myosin and actin are the contractile protein present in skeletal muscle, and regulatory protein are tropomyosin and troponin. Regulatory protein are tropomyosin and troponin. Thick filaments are made of myosin and thin filaments are made of actin, troponin and tropomyosin. Okay, next one. Tropomyosin in the muscle fiber is a protein. This is a dash protein. So, which type of protein? Now, just now I told you it's a regulatory protein. Tropomyosin. Here I told you tropomyosin and troponin are regulatory protein. Tropomyosin and troponin are regulatory protein. Next, skeletal muscles under microscope have cross striation formed by dark and light bands. The dark bands are formed by, actually now as per my teaching module, technique of teaching, usually I will read the question, I will take the particular theory part and I will explain everything. But as if we don't have enough time to take class like that, maximum questions we have to cover. For that only I'm just reading the question and answer here. And if we are getting enough time means I would have taken class very detailedly, but there is no enough time. Maximum, it's your aim to read maximum question and find out the correct answer. Okay. Okay, here skeletal muscle under microscope have cross striation. Skeletal muscles have cross striation. That's why it's known as what? Striated. Striated voluntary. Skeletal muscles is known as, what are the features of skeletal muscles? Is striated and voluntary. We can control the movement of skeletal muscles. That's why it's known as voluntary. Okay, they have cross striations, dark and light band. Dark and light band is there. Dark bands are formed by protein myosin. Okay, dark bands is protein. Dark band of skeletal muscles is formed by myosin. Okay, immediate source of energy for the muscle contraction. What is the immediate source of energy in the muscle contraction? That is adenosine triphosphate. That is our ATP. ATP, adenosine triphosphate, is the immediate source for energy in muscle contraction. Next question, sarcomere. Sarcomere refers to that portion of the myofibril between. Actually, you have to study the structure of skeletal muscle and cardiac muscle, smooth muscle. These are the three types of muscles in our body. That is skeletal muscles, smooth muscle and cardiac muscles. Okay, and there you will study this band and all. Sarcomere refers to that portion of the myofibril between two Z band. Between two Z band, we can see sarcomere. Sarcomere refers a portion of the myofibril. Myofibril between two Z band. Okay, sarcomere is the unit of contraction of the myofibrils of a muscle cell made up of protein filaments arranged between two Z band or disc. Which of the following, which of the below is the true statement about H zone of sarcomere? H zone of sarcomere, which is the true one? It contains thick filaments only. H zone means it contains thick filaments only. That is the correct point. It contains thin filament only, wrong. It contains thick and thin filament. It contains thick or thin filament. That is wrong. Correct option, it contains thick filament only. H zone means it contains thick filament only. The next question, what is the main source of energy for cardiac muscle? What is the main energy source for cardiac muscle? That is fat. Glucose, fat, protein, lactic acid. These are the options. Correct option is fat. Fatty acids are the heart's main source of fuel. Although ketone bodies and lactate can serve as the fuel for heart muscles. Okay, main source of cardiac muscle is fat or fatty acids only. But even though fat is providing energy, sometimes ketone bodies and lactate that also produce giving energy or fuel for heart muscle. That means cardiac muscle. In fact, cardiac muscle consume acetoacetate in preference to glucose. There is no glycogen stored in heart muscles. As there is no glycogen storage or glucose stored in heart muscle, sometimes it will use acetoacetate as a muscle means energy source. Next, when a muscle relaxes, which of the following occurs? When a muscle relaxes, the nerve stimulus will be removed. Okay. All the ATP is used up? No. The actin binding sites are saturated? No. The nerve stimulus is forceful? No. when nerve stimulus is removed, then only that muscle will relax. Okay, next question, type of muscles. Type. Okay. Type of muscle. Striated muscle is there, non-striated muscle is there, cardiac muscle is there. The mainly other names is skeletal muscle, smooth muscle, cardiac muscle. These are the types of muscle. Correct option, option D, all. On the basis of histological structure, muscle tissue in the body divided into three types. Smooth, that is non-striated. Skeletal is striated. And other one is cardiac. Okay, these are the three types of muscle present in our body. Next question, largest smooth muscles of the body. Largest smooth muscles in the body, that is stomach. Stomach is made up of smooth muscle and it is an important big organ. Okay, so the largest smooth muscle is contained in our stomach only. Okay, femur, humor, scapula, these and all bones. Okay, muscle tissue that lacks cross striations on its fiber and work involuntary called smooth muscle. What is meant by smooth muscle? It does not contain striations. It does not contain cross striations and it works as involuntary. That means we can't control that muscle. That type of muscle is not a smooth muscle. It found mainly in our inside of the body, that means inner organs. Example like stomach, liver, intestine, urinary bladder, uterus. So many organs. These all organs are made up of smooth muscles only. We can't control the contraction, relaxation, and functioning of these organs. That's why it's known as involuntary. We can't control them. Next, rectus abdominis is the largest smooth muscle is stomach. Rectus abdominis is the longest smooth muscle in the body. Sartoris is the longest skeletal muscles. Okay, just note it now. Largest smooth muscle is found in stomach. Rectus abdominis, each muscles have their own names. Rectus abdominis is the longest smooth muscle and sartorius is the longest skeletal muscle. In femur, humerus and scapula, found skeletal muscles, not smooth muscles. Okay, so not smooth muscles. Smooth muscles will not attach skeletal and it is found in inner organs only. Muscles which attach skeleton system or bone is called skeletal muscle. Okay. Next question. All of the following organs have involuntary muscles. Involuntary muscles except stomach have involuntary muscle we can't control. Intestine have involuntary muscles. Heart have involuntary muscle. But skeleton have skeletal muscles that is voluntary. Okay, voluntary. Voluntary. Next, the type of muscle found in the visceral organs and blood vessels is called type of muscle in the inside. Visceral organs means inside our inner organs and blood vessels have involuntary muscle. Cardiac muscles found only in the heart. Okay, myocardium is in the heart. Voluntary means skeletal muscles. It's not a visceral organs. It will attach with the skeletal system. Blood vessels and visceral organs are that are both are involved. That means we can't control the functions and contraction, relaxation of our inner muscles. That is involuntary muscles. Okay. Next question. The function of smooth muscles: create heat, propel blood into circulation, propel food through the GIT, gastrointestinal tract, cushion organs. Correct option, propel food through the GIT. Smooth muscle mainly seen in the GIT, digestive system, and all organs contain smooth muscle. So what is the main function of smooth muscle? That is propel, movement of food or peristaltic movement of food through the GIT. Okay. Next, some other questions. Which of the following is not a feature of life? What is the not a growth is the feature of life? Responsiveness is the feature of life. Reproduction is the feature of life. Organ system is not a feature of life. Organ system is a division of our body. Is it? Except organ system, other options are basic life process that distinguish from living to Non-living. Non-living things will not grow, will not reproduce, will not respond. Okay. Six most important life processes of human body are metabolism, responsiveness, movement, growth, differentiation, reproduction. These are the characteristics of a process occur in living body. Okay, not in non-living body. Cell, tissue, organ, system and whole body are structural hierarchy or compositional system of the body. Next question. Among these, which is noble gas, except except one except one, all are noble gas. Helium, neon, argon, fluoride. Fluoride is not a noble gas. Noble gases are the chemical elements in group 18 of the periodic table. They are most stable elements due to maximum number of electrons in their outer shell. Natural occupying 6 noble gases. What are the 6 noble gases? Helium, neon, argon, krypton, xenon, radioactive, radon. Okay, these are the 6 noble gases. Mitosis is a condition of cell breakdown, cell division without reduction, cell death, cell division with a half chromosome. That is cell division with a half chromosome. Yes. Sorry, cell division without reduction. Cell division without meiosis. Meiosis is cell division with a half chromosome. Cell division without reduction. That is known as mitosis. That is its process of cell reduction. Mitosis is a type of cell division of somatic cell in which each daughter cell contains same number of chromosomes. The chromosome number will not reduce. Meiosis means there it will divide into two. Chromosome number will be divided into two. These are the two types of cell division, mitosis and meiosis. Okay. Next, correct sequence of mitosis. Telophase. Already I explained the cardiac cell cycle and I explained in the videos. You can watch and study if you want to study that one. Okay. Telophase, anaphase, prophase, telophase. Correct option. We will go to correct option. First option is prophase. Prophase, metaphase, anaphase, telophase. These are the correct sequence of mitosis. Prophase, metaphase, anaphase and telophase. Next, number of chromatids at metaphase is number of chromatids at metaphase. That is 2 in both mitosis and meiosis. Number of chromatids. Number of chromatids at metaphase is 2. Next, out of the chemical forces or bonds listed below, longest one, which is the longest chemical force or chemical bond, that is covalent bond. Van der Waals bonds, dipole, hydrophobic. In the covalent bond is the longest bond. Ionic and covalent bonds are stronger bond, and van der Waals and dipole hydrogen bonds are weaker bonds. Okay, van der Waals dipole hydrogen bonds are weaker bond. Next one, an energy consuming process by which cells of the body, human body, absorb molecules by engulfing them. What is that process? Engulfing that particular molecule means that is endocytosis. Endocytosis. These are the movements in the process of transporting movements. When we studied physiology of cell, no, that time we studied the mechanisms of or transport mechanism of cell. There we studied endocytosis. Endocytosis is a method of ingestion of a foreign substance by a cell. Phagocytosis is a form of endocytosis, so the same thing. Engulfing. Here one foreign material is there, cell will come and it will cover this organ and it will make inside of the cell. That process is endocytosis or phagocytosis. And it's contained 3-stage process. Phagocytosis means 3-stage process. Exocytosis means if there is any material inside the cell, it will be expelling out of the cell. That is exocytosis. Okay. Next, which plane divides the brain into unequal right and left portion? Unequal right and left portion. Okay. It is mid-sagittal and means making into 2 equal halves. Parasagittal plane divide unequal right and left portions. Okay, there are 4 planes. Sagittal plane. This class also already I did. If you want to see, you can see that one. transverse plane, frontal plane, and oblique plane. Sagittal plane means a vertical plane through the longitudinal axis of the body or organ and divided into right and left equal parts. It may be mid-sagittal or parasagittal. If it is divided into two equal parts, right and left, then it is mid-sagittal, and it is making divided into unequal right and left half means parasagittal. Okay. Next, transverse plane or cross-sectional plane means it divides body and organ into superior and inferior. It's like this, superior and inferior. This making two parts. That is transverse plane. Next, frontal plane means or coronal plane means divide body and organ into anterior. It's like this. In the head, it will divide like this. Front side and back side. It will go to front. Front side will be called as anterior portion. Back side will be known as posterior portion. That is frontal plane. And oblique plane means obliquely it will cut the organ. Then it is oblique plane. These planes and all everything I explained in the class. Okay, next one. A plane that passes through midline of the body and divides into equal right and left. Equal right and left means mid-sagittal plane. Unequal right and left means parasagittal plane. Okay, front anterior and posterior means coronal plane. Characteristic of enantiomer. Enantiomer means only that they are chemically identical, only that are mirror image of both chemically and mirror images same means we can tell enantiomer. Enantiomer or enantiomorph are one of the pair of isomers. The chemicals is mirror images same as well as what chemically identical. Then it is known as enantiomer. Isomers means dextro. If they rotate right to right, levo if they rotate left to left, right. That and all is known as isomers. These all will come under chemistry only, but they will not ask. Next question: hydrolysis of fat. Hydrolysis of fat by alkali. Hydrolysis of fat by alkali is known as saponification. Soap formation. Is it? When you studied about lipids you will study about this. Hydrolysis of fat by alkali is known as, this process is known as saponification. Saponification is a formation of soap, means the hydrolysis or splitting of fat by alkali yielding glycerol and 3 molecules of alkali salt or fatty acid. Then form this process through the saponification we can create soap. What is the observation of tissues with the naked eye to study this disease called? Okay, naked eye study is known as gross pathology. Gross pathology. Gross pathology means macroscopic manifestation of disease and eye organ. It's with the macroscopic means with eye we are seeing. Microscopic means we are seeing under microscope. Next question. Biological barriers include all except. Barriers means is something limiting or obstructing or restricting, then it is barrier. Biological barrier means include all except. Biological barrier, cell membrane is a biological barrier of cell. Capillary walls, it's limiting the transport of things or like electrolytes through the capillary walls. Placenta also, it's a limiting membrane. These are all biological barriers only. But renal tubules is an organ. It's an organ in our renal system. It is not a barrier. Okay. Next, what kind of substance cannot penetrate permeate membrane by passive diffusion? What type of substance? Hydrophilic substance can't be permeable, can't be transported through the cell membrane. Okay, hydrophilic substances can't be transported. Hydrophilic means water loving. Simple diffusion is an example. That means for this and all you should read transport mechanism like diffusion, osmosis, facilitated diffusion, like that use osmotic pressure, this and all you should know. Simple diffusion is an example of passive diffusion. Solute or substance move across the membrane without energy means diffusion. Simple diffusion. With energy means facilitated diffusion. Next question. Blackened decomposing tissue that is devoid of blood circulation is known. is known as, means like a tissue died and it become blackened, then it is known as gangrene. Okay, gangrene means necrosis or death of tissue resulting from deficient or absent of blood supply. Suppose any blood is doesn't receive blood or oxygen, means it become dark or died, that is known as gangrene. Next, congenital absence or closure of normal body orifice or tubular organ is known as congenital. Congenital means by birth. By birth, a particular organ or means it's a particular orifice or tubular organ is closed, then it is known as atresia. Particular organ is closed, then it is known as atresia. Atresia is a congenital absence or closure of normal body opening or tubular structure. Next one. Who introduced the principle of inheritance? Who introduced the principle of inheritance? That is Graham Mendel. Mendel is introduced principle of inheritance. Next question. The protein present in mucus. The protein present in mucus is mucin. Mucin is the protein present in mucus. Mucin is the glycoprotein. Glycoprotein is protein with the carbohydrate. This is glycoprotein found in mucus. Next question. The analysis of the patterns of the loci of structures within the body plan of an organism that forms the basis of taxonomical categorization. That is comparative morphology. Comparative morphology, we give the comparison between loci structure analysis. Next question. Large mass of scar tissue developed and extending beyond the wound surface is known as large heaped up mass of scar tissue developed and extending beyond the wound surface is known as acne scars, contractile scar, hypertrophic scar, and keloid. Correct option is keloid. Keloid is the correct option. Or scar tissue. Naturally, if there is any wound, it will be healing and there is a formation of scar tissue. If this scar tissue developed and extending beyond the wound, is extending in the highway, means extending beyond the wounds, it's a big scar tissue, means it is known as keloid. Okay. Keloid is an exuberant scar that forms the site of an injury. It forms at the wound and it spread beyond the original border. Then it is known as keloid. Next question. Which proteins are classified based on their function? Okay, which protein is classified as based on the function, that is protective proteins. Based on the structure is known as fibrous protein, globular protein, and simple protein. Here protective protein means it's based on its proteins have protective function. It's known as protective proteins. Next question. Primary structure of protein represents. Primary structure of protein represents linear structure of protein joined by peptide bond. That is the primary structure of protein. Okay, linear structure of protein with the peptide bond. Next question. Dash are atoms having the same mass number but different atomic number. That is isobar. Two or more chemical bodies having same atomic weight or mass but different atomic number. Same atomic mass. Then it is known as isobar. Okay. Isotope means same atomic number. Next. Germline gene therapy is heritable. Germline gene therapy is heritable. Next, germline gene therapy rules, that rule is not important. Which of the following is called nucleons? Nucleons means valence electron, nucleus and protons, protons and neutrons. Protons and neutrons are known as nucleons. Nucleons means protons and neutrons. Any of the particle that collectively make up nucleus of the atom called nucleon. Proton and neutron are present in the nucleus. So it is known as nucleon. Next, tissue in histopathology are carried out. Tissues in histopathology are carried out in 10% buffered formation. 10% buffered formation. Next, the genetic exchange process in which donor DNA is introduced to the recipient by a virus is called genetic exchange. Genetic exchange process, donor will be donating DNA. That DNA is transferred or introduced into recipient by a virus. This process is called transduction. Okay, transduction is the genetic recombination in bacteria in which DNA is carried from one bacterium to another by a bacteriophage. That is like a by virus that infects bacteria. Okay, it's called transduction. The activation of caspases is likely to lead to caspases. Activation of caspases is likely to lead to apoptotic apoptotic cell death. Apoptotic cell death. Okay. Pignosis is characterized by nuclear shrinkage. The word terminology is just noted. Pignosis is known as nuclear shrinkage. It means shrink, means constriction of nucleus. Okay, nuclear shrinkage. Okay, till here we will finish here. Okay, next blood we will take class in evening or tomorrow morning. Tomorrow, okay. These 90 questions you just read. These genetic questions and all, you should no need to get confused. Just cell, tissue, types of tissues and all, you just finish it that. As much as possible, you read more question. It will be very helpful for your exam. You don't go for theory notes now. You can't complete within 1 month. Actually, only 40 days is there. You can't complete our 4-year portions. If you studied theory portion, just start preparing MCQs. If you are not studied theory portion also, just start MCQs. It is more effective than theory. Okay. Okay. Thank you for watching. Bye bye.